will present to you on the regulatory framework for black pepper in the United States. And as the executive director of ASTA, she works with the ASTA board of directors to set the strategic direction of the association. She has a strong background in domestic and international regulatory issues and has a proven track record of success in addressing challenges related to the supply chains of food ingredients sourced from developing countries. Laura received her Masters of Health Sciences from the Johns Hopkins Bloomberg School of Public Health and Bachelor's degree in Food Science from the University of Wisconsin. She's an active member of several professional societies, including the Institute of Food Technologists, where she serves as the chair of the Food Laws and Regulations section. Ms. Laura, the screen is all yours. You can make your presentation now.
Thank you guys so much for having me here today. It's an honor to be with you. Happy New Year. I know we're all very hopeful that 2021 proves to be a better year than 2020 was, and hopefully we're off to a good start and all of you have had a good year so far. During today's presentation, I'm going to start off with an overview of the impact of COVID-19 on the spice industry in the United States. So this dovetails really nicely with what Giridhar just presented as well about the impact of COVID-19 on the pepper industry. Next, I'll move into a broader update on the regulatory issues and policy issues in the United States that the pepper industry should be aware of. And finally, I will close out the presentation with an update on some of ASTA's activities that I think will be interesting to all of you. I'd like to start off with an overview of what the Codex Secretariat has summarized as the key issues that have impacted the spice sector related to COVID-19. Although Codex was not able to meet in person this year, as any of us have been, they continue to do their work electronically, and the Secretariat of the Codex Committee on Spices and Culinary Herbs has summarized the challenges in the spice sector related to the COVID-19 pandemic. These include raw material shortages, labor shortages, infrastructure disruptions, changes to operating procedures, ensuring quality of products, as well as volatility in market and economic pressures. These are global challenges that all of us as an industry have faced together in the last year and is certainly impacting the way that we're all operating right now. The United States has been particularly hard hit by the pandemic, which continues to have a sustained substantial impact on all aspects of American life. In terms of the specific impact to the spice industry, early on in the pandemic, key challenges that spice companies faced included supply shortages in the midst of unprecedented demand. Companies also needed to quickly implement new operating practices to protect employees, and many companies were facing shortages of personal protective equipment, such as face masks. At this point, the pandemic continues to impact consumer purchasing behavior and also manufacturing practices. Also, of course, many of the countries that are incredibly important to the supply chain have also been impacted as well, such as India and Brazil, who have been amongst the top in outbreaks also. Although early on, there were significant concerns about the availability of spices, in particular related to the lockdowns in India and other growing regions, the spice supply chain seem to have recovered at this point, and we're not currently experiencing widespread shortages. However, supply does continue to be tight due to availability of labor, transportation delays, and increased demand generally across the spice sector. Unfortunately, in the United States, food processing facilities, and primarily this relates to meat processing facilities, have been the cause of several outbreaks. Meat processing is uniquely challenging in that it requires greater amounts of manpower working in very close proximity than typical food processing facilities. The outbreaks resulted in short-term closures of some meat processing facilities. In response to these closures, the American president, Donald Trump, ordered the facilities to reopen to prevent shortages in the meat supply. At the same time, U.S. government agencies worked to develop guidance on how to operate safely in meat processing facilities. And this guidance that was developed originally for the meat processing facilities really became the foundation of guidance that the U.S. government was providing to broader food sector in the United States. While the US government agencies, including the Centers for Disease Control, or CDC, the Food and Drug Administration, FDA, and the Occupational Safety and Health Administration, OSHA, have released guidance and information for food industry operations, many aspects of how the pandemic is being handled in the United States are being implemented at the state or local level, with differing regulations and measures in place in regions that are harder hit by the virus, and also very significantly impacted by political affiliations. It is critical that the food sector focus on keeping employees safe and healthy while continuing to operate. And in general, food processing facilities have responded with increased safety measures to promote hygiene and social distancing practices, including controls to promote social distancing and prevent employees from congregating, which in some cases has really meant a lot of management of shifts to prevent overlap of employees. And this, in some companies, has also resulted in the production of fewer variety of products, so fewer SKUs overall, although not a drop in production of food output in totality. We also see, of course, required mask wearing, enhanced sanitation procedures, and employee screening to ensure that sick employees stay home in quarantine, as well as extreme visitor restrictions. With respect to visitor restrictions and also the travel restrictions that most of our industry have been up against in the last year, we've also seen a really interesting role of how virtual audits have played in the pandemic. Although on-site food safety audits in some parts of the world have mostly resumed by Global Food Safety Initiative and customers, many US companies are still currently prioritizing only the most critical audits to be done in person, and they've started to move to doing a mix of some on-site audits for those most critical food safety audits, as well as some blended food safety audits, meaning that you could have some portions of the audit be virtual and other portions in person. And then some audits that are less critical at this time, doing them actually virtually in entirety. For example, some companies are choosing to prioritize conducting critical food safety audits in person, and then relying on on virtual techniques for lower priority audits, and also certification audits, such as kosher and organic, that aren't food safety related. It is critical that companies recognize that requirements remain the same, even if auditing practices are changing a little bit, and that GFSI and other certifications need to be maintained. That still continues to be important to the American market. But it's interesting to see how these auditing practices are changing the way that we're operating. Virtual audits can include, and this is evolving at this point, this is very exciting, but virtual audits can include video walkthroughs, virtual records reviews, video conferencing with employees, and there are other types of technology that are being used in these audits. And it's likely that the future of auditing will incorporate lessons learned from this time. I'll talk a little bit about what's happening with the regulatory audits. Really, these virtual audits we're seeing play out mostly when it comes to customer audits, not so much from the regulatory audits, although there is some development in that area potentially in the US. As a result of the challenges that the spice industry has faced due to the pandemic in the last year, companies need to continue to manage ongoing supply disruptions, and many companies have needed to seek new suppliers. The major concern companies have shared at this point is the ability to ensure high quality standards are being met during this chaotic time. Anytime companies seek new suppliers, and especially now when things are somewhat chaotic, supply is tight, demand is high, there is the potential risk for fraud and adulteration. Recognizing this concern, US companies have needed to enhance their screening efforts to detect potential quality and adulteration issues. And additionally, the ASTA Spice Integrity Council is working on ways to better detect adulteration in spice supply chains. This is one of the key issues that we're addressing at this time. The United States government has prioritized ensuring that Americans continue to have access to a safe and secure food supply throughout the pandemic. As with many countries, the food industry in the United States is considered to be a part of the critical infrastructure. Given the importance of the food supply and the outbreak incidents that occurred in food processing facilities, the US government is advising that the food and agriculture sector be prioritized in the next phase of vaccinations. which we're referring to as phase 1B. Currently, we're in phase 1A, which is providing vaccinations to healthcare workers as well as residents in long care facilities such as nursing homes. Ultimately, each state will be responsible for its own distribution plan for the vaccine, and at this point, many of the details of distribution are still being worked out. The first round of vaccines is currently being distributed, and the next phase of distribution, which we originally estimated would start later this month, this is the next phase in which we would hope that it would go to food production workers and agriculture workers. We're not entirely sure when this will start, but our hope and our original anticipation is that it was going to start later this month. But at this point, we already see that we're behind on vaccinations in the first phase. Recognizing that there will likely be shortages of the vaccines, the CDC has issued guidance on how to prioritize vaccinations in this next phase that includes the agricultural workers. And the recommendation is to prioritize workers in areas where we see high COVID rates, high-risk workers who have higher risk due to age or underlying conditions, and workers who have not had documented incidents of COVID in the last 3 months. At the beginning of the pandemic, consumers began stockpiling shelf-stable food and household items in anticipation of potential shortages. Well, this behavior initially resulted in short-term shortages of some specific food products. Supply has mostly caught up with demand, and this purchasing behavior has not continued. However, we have seen a sustained increased volume of grocery purchases overall. In particular, we've also seen continuous increases of the snack category, frozen meals, and also dessert purchases. As we continue to experience economic hardship, many Americans are motivated to seek out value items, such as the private label products, but we've also not seen that this is hurting the purchasing of branded products, which have also experienced a sustained increase. Although Americans are on average going to the grocery store less frequently as concerns continue about contracting COVID in public places, we are seeing that there is a continued increase of grocery items per volume in each trip. So less trips to the grocery store, but higher volume of purchases per trip. Additionally, one of the trends that we've seen is that grocery delivery services have become extremely popular. And we expect that this is a trend that's actually going to continue past the pandemic. And with the extra time at home, American consumers have embraced cooking more. So we're seeing more sharing of recipes, more interest in recipes. Meanwhile, the restaurant sector has suffered throughout the pandemic. Local regulations in most communities throughout the United States resulted in restrictions of in-person dining at restaurants. Although takeout spending has been consistently strong throughout the pandemic, it really has not been enough to make up for the massive spending gaps for in-person dining for restaurants. While it's uncertain what will occur in the coming months, it seems likely that consumers will continue to embrace the grocery delivery services, will continue to opt for lower cost and value items, and also will continue cooking more at home. Other trends that we've seen include the blurring of lines between grocery and restaurant food options. For example, many of the restaurants in my neighborhood here are offering innovative solutions, such as selling a meal kit, which has some of the meal prep done so you can cook partially at home, as well as grocery stores selling more like restaurant prepared items. Another emerging trend as Americans begin to miss out on vacations and overseas travel has been the growing interest in more ethnic cuisines and expanding the recipes that they're cooking at home. Overall, the food industry has experienced a steady increased demand of food, although there's been marked variability with some sectors experiencing significant increases and, of course, ongoing losses for the restaurant sector. ASTA has also been significantly impacted by the pandemic. Of course, we were not able to hold our trade show last year. We're also moving to a virtual trade show in 2021 in the early part of the year, and hopefully to an in-person meeting later in the year. So our activity in 2020 was shifted dramatically, and we spent most of our time responding to issues related to the pandemic, primarily in serving as a liaison between the industry and also the U.S. government, the industry with the U.S. government, to advocate for the spice industry's continued ability to import spices and to operate throughout the pandemic. Additionally, we work to provide resources and education about what the food industry needs to know about the coronavirus and how to operate safely and within government regulations. Meanwhile, we're continuing to work against our typical strategic goals, but we've had to do so differently as we've been working virtually. I'm going to talk a little bit as well about the impact of COVID on routine U.S. regulatory inspections. U.S. regulatory agencies have continued to inspect and enforce all existing requirements for imported foods, although FDA temporarily suspended routine in-person food safety inspections domestically between March and July. These inspections have now resumed. We have not yet seen in-person foreign inspections resume, but FDA tells us that they will resume them as soon as it is safe to do so. In the meantime, we've seen that FDA has ramped up enforcement of the Foreign Supplier Verification Program. And the reason we've seen that is because the FDA is allowed to do those inspections virtually. FDA is not allowed to inspect against other FSMA regulations virtually, such as the Preventive Controls Regulation, but they are allowed to inspect against the Foreign Supplier Verification Program virtually. So at this time, all importers must have a foreign supplier verification plan in place if they're importing into the United States. So if you import into the United States, this is a very good time to make sure your FSVP is up to date. We have more information about this on the ASTA website, what you need to do to comply. We have recorded webinars and other information available so you know what to do, because we've seen quite a bit of enforcement as FDA has moved a lot of their inspectors to doing this enforcement, which is something that can be done virtually. While FDA continues to enforce food safety requirements, as a result of the response to COVID-19, we have been able to ask for some flexibility as it relates to labeling requirements. So this is something that has been beneficial to the industry. Additionally, we have seen that the pandemic has resulted in a delay of the implementation of some new requirements that we were expecting. That is now actually sort of starting to get going again. And also the release of guidance documents. So at this point, we're seeing regulatory activity mostly return to normal, although there have been some delays. At this point, FSMA implementation, the Food Safety Modernization Act, is basically finalized. Actually, just yesterday marks the 10-year anniversary of when President Barack Obama signed the Food Safety Modernization Act into law. And at this point, FDA is basically seeing this as complete. All of the requirements are out there. Companies need to be in compliance with them. And while originally FDA was in an educate before regulate mode, they were not taking significant enforcement action while companies were getting used to the new rules. They've really moved away from that mode into an enforcement focused mode. And so we're seeing FDA issue warning letters against violations that they observe, and violations by foreign companies can certainly result in bans of the product being imported into the country. All facilities that supply products to the United States are required to re-register with FDA every 2 years and to have food safety plans in place. Key regulations that you need to be in compliance with for the spice sector include preventive controls for human food and the Foreign Supplier Verification Program rule. We have resources on our website to help companies identify which of these rules pertain to them and how to comply with them. FDA is continually enhancing its screening of imported commodities to detect potential hazards. If a given commodity has a history of violations, this results in more screening of that commodity. FDA uses a predictive model to target sampling and testing of imported products that are likely to be violative. For black pepper, Salmonella is by far the highest import screening priority for FDA. While not as frequently screened, we still see FDA testing imported pepper for pesticides, heavy metals, illegal dyes, and other things at times. If FDA detects Salmonella or another food safety hazard or adulterant, the company may be placed on import alert or detention without physical detection, which means that each subsequent shipment of the product will be held and must be demonstrated to be safe prior to release, as well as the original shipment, of course, being held by FDA until it can be released. Import alerts may apply to a specific manufacturer, or they could apply broadly to a product or a product from a certain region. For example, FDA has long-standing import alerts in place for all black pepper from India and Brazil. To successfully advocate to release a product that's on import alert, companies must demonstrate to FDA how they are going to control the hazard, or how they're going to recondition the product, would be the terminology that FDA uses. If the hazard will be consistently controlled by companies, the U.S. importers may request to be green listed. So if there's a countrywide import alert, for example, since there is an import alert for all pepper from India, if a company says we don't want to have to go through this every single time, that company can petition FDA to remove them from that import alert. And there is a process that is outlined on the FDA website about how to do that. This process is not new. This is the long-standing approach that FDA has taken to evaluating the safety of imported products. But what is new is that a part of this process of getting the product off of detention or requesting to be removed from an import alert is that FDA now is requiring that companies demonstrate that they have validated process controls to control salmonella in spices in place. Previously, companies may have been able to achieve release from an import alert or release from detention through testing of the product. Now, FDA will want to see that the company has a validated food safety control to ensure that there's evidence that whatever treatment is being applied is sufficient to kill salmonella. This is a part of how we're seeing the actual rubber hitting the road of how FSMA implementation is impacting FDA enforcement of the imports of black pepper. So what exactly does the validation of a process control entail from the perspective of FDA? According to FDA FSMA regulations, control of food safety hazards such as salmonella need to be validated, and the validation involves obtaining and evaluating scientific and technical evidence to determine whether the preventive control will effectively control the hazard. This serves as the scientific basis for the preventive control. The validation must be conducted by preventive controls individual and considering the variability of each spice process, each company is really in a position where they should be conducting their own challenge study. So this means inoculating samples with known quantities of salmonella or a surrogate bacteria that behaves similar to salmonella and demonstrating a 5-log reduction. In our experience, FDA is really heavily scrutinizing the design and documentation of these studies and has fairly high expectations for how in-depth and thorough these studies are. Most importantly, these studies must be conducted on the most conservative and worst case scenarios for all of the processes, meaning that the process conditions that would result in the lowest level of treatment being applied are the ones that are tested in the study. There's more information on the ASTA website about the validation of process controls, but I really want to leave you with, we are seeing this be a key requirement of the enforcement right now, and expect this to only increase in the future.
Excuse me, Laura.
Yeah?
We may soon run out of time, so can you please make it a little...
Sure. Sorry. Yeah, I will.
There's so much of good information coming, and we don't want to stop you, but time is a constraint, so please. Thank you.
Sure. Yeah. So I'll also just say, one of the key things that ASTA is working on is applying for new pesticide tolerances, and this is intended to expand the tolerances that are available for black pepper. We've applied for 2 new tolerances so far: metalaxyl and difenoconazole. FDA is also moving into some new food safety regulations in the future. We're looking at some expectations around new traceability requirements. This is proposed at this point and still really being developed. You certainly expect changes with our new administration. Definitely going to be a different kind of environment under the Obama administration. I also just mentioned a couple regulatory developments to be aware of. You guys can look at this in the slides after. And finally, I really just want to say that one of the things that has been critically important to ASTA as we've looked at our strategic plan is how we better collaborate with our partner organizations around the world, including the international pepper community. And I'm really excited that Leanne has reached out to me about formalizing our relationship between ASTA and IPC. So this is something that we're really excited to get started. So I include a couple of other resources here that you guys can look at after. And, finally, just want to encourage all of you guys to participate in our virtual education, which we're planning for later this year, a similar conference such as this. And then we're planning an in-person meeting in October of this year with hopes that we'll be able to see each other at that point. So thank you guys so much for having me. I've included my contact information here in case you want to reach out to me, but I'll be available for the questions now as well.
All right, thank you, Laura. Very nice, and a lot of information that you have pumped at the audience. And I'm sure a lot of exporters may have had difficulties because of poor understanding of the import regulations. And now with this changed scenario because of this COVID, things are going to be even more tougher. And with the virtual audit, this is a new way of life. Even if the pandemic is over, but these things are going to be a part of an exporter's part of their life. And regarding the FSVP, thanks for updating everyone that all exporters have to get this done and be ready with that. Otherwise, their consignments can get into problems. And I have one question. You said now the import alerts are based on a country or a region as well. It's possible. Now, India and Brazil did get a region alert. Now, if it were for a private company, they could apply to the FDA for removal and there's a verification process. But how do a country get off this alert?
Yeah, that's very difficult. These alerts for India and Brazil have been around for years. I think the Brazil alert's been around for like 30 years. It's very, very difficult once an import alert has been issued for an entire region to petition FDA to actually get rid of that entire countrywide alert. The times that I've seen that be successful is by working through a trade organization. So for example, the international pepper community, you guys collectively could work together to demonstrate that information to FDA. It's a lot more challenging for an entire country to get off the alert. I could see also a government doing it. I've not had experience with that myself, but I think if, for example, the Indian government wanted to work on that issue, perhaps that would be something that would be an effective way of doing that as well. I just haven't myself seen that be successful. It's just really challenging. A company can say, we have these procedures in place, we have GMPs in place, we have controls in place, we have a validated food safety control plan, we use ethylene oxide, we use steam, we have 5-log reduction. But at the end of the day, salmonella is a risk that occurs in pepper, in raw pepper. So to be able to demonstrate that an entire country, every single supplier is in compliance, it's a very difficult bar and one that is unlikely to
Probably an agency like the Spices Board or a trade body like the ISEF could collate data on various strains and then submit or represent the whole country and submit the petition to the FDA. I think that's the only way possible. Okay, thanks for that. And for a company who has gotten to the alert, how long would it normally take for them to come out of it?
It can take quite a while. So what FDA likes to see in particular is 5 consecutive clean samples. So they'll continue to test and show, so that they can see this is working 5 times. And then it takes some time to get the review. In generally months, not years, but maybe 6 months. 3 to 6 months, I would say, is pretty standard. It varies by the circumstance.
ASTA website would have guidance on how to approach this.
Yeah, and the FDA website actually has some good guidance as well. And I can recommend also some consultants and experts that specialize in helping companies with the process as well.
All right. Okay, thank you very much, Laura.
Please download the IPC Farmers app for your country from the Google Play Store or from the App Store for more training videos, guidance on cultivation, daily price information, marketing support, exchanging ideas with other farmers, and for online help from an expert. Search for IPC Farmers app.